Hello all, I am Dr. Walter from SNS College of Physiotherapy. So today we are going to see in another topic based on the shoulder injury. Why we are taking a common of the shoulder injury. Before entering into a particular condition, we need to analyze why a certain area is having n number of injuries. Yes, why? Because shoulder is most important in a day-to-day life. As we want to go from one place to another, as for now we are using our motorbikes. Yes, before that and all, the motorbikes implementation is very less, but today the implementation of the motorbikes and car usages are very much high. Okay, so for each and every locomotion the legs are using, but most commonly the hands are playing a greater role in the movement. Okay, so before entering in this topic, shoulder, which is compromising of the humerus and the scapular glenoid cavity. Okay, this glenoid cavity is very much smaller in shape compared with the head of the humerus. That's why a number of muscles and the attachments of the ligaments are taken place in the shoulder area to maintain the humerus in the position of the glenoid cavity. So the synovial joint, which is taking place in this area, which is helpful in the lubrication and also in the movement. Now going for the major four conditions of the shoulder joint injury, is the first one is the rotator cuff tear. Rotator cuff injury or rotator cuff tear, which will be compromising of the four major muscles. There is the sixth muscle, supraspinatus, infraspinatus, teres minor, and the subscapularis. And these four muscles will be contributing for the rotator cuff area. Why these four muscles? All these four muscles will be in a cuff shape. What is cuff? It is holding something. What it is holding? It is holding the shoulder joint. So from the anterior, the posterior, the inferior, and the sides, it is holding the shoulder joint. Now, injury to this area, that is injury for any of these four muscles, will implement the rotator cuff tear or the injury. In what and all cases this rotator cuff will go for the injury? Overhead activities. For example, if I am playing a shuttle or badminton, same. Okay, if I am overhead and pulling the racket for the cock, what will happen if I am not going for a warm-up exercises and straight away entering into the ground and playing this shuttle? If the muscle is not so strength, it will go for the tear. Why? Because it is holding the joint in a very much tensed surface, and it will create a tear in the rotator cuff, and this will create a problem of the pain and the immobilizing of the shoulder joint. Now going for the second thing is the shoulder impingement syndrome. What is shoulder impingement syndrome? As of now, this rotator cuff tear is going for the shoulder impingement syndrome. This rotator cuff will suppress the shoulder area, and this impingement will create a painful arc in the shoulder area. For example, if the person is going for a abduction area, okay, so if he or she is going for the abduction like this, the painful area will arise on the shoulder region, and this will create a painful arc syndrome or a shoulder impingement syndrome. This is most important, that the rotator cuff muscles are not so strengthened, it is in a weakened state, and it is pressing the acromion area. This will create the shoulder impingement syndrome. Now going for the next one is the shoulder dislocation. Absolutely in a trauma stage. What is trauma? In a RTA, or if a person is climbing upstairs or climbing in a stairs, if he is falling down and keep his hand as a supporting area, if this area muscles are not so strengthened, it will go for dislocation. Most common dislocation is the anterior dislocation of the shoulder, and this is most common. Why? Because of the head of the humerus is greater than the glenoid cavity. As I told you in the starting of this video, glenoid cavity is very much small compared with the head of the humerus. Okay, all the surrounding surfaces, structures of the muscles are holding this in a position. If these are weak, it will go for a dislocation, and this is most common in more old age patient when they are falling down. Okay, now going for the last stage is the frozen shoulder. It is the most important and the common condition during this winter season. As we are entering into the winter season, this frozen shoulder is most common among the patients who are affected with the diabetes and also with the heart problems. Frozen shoulder at initial stages will be going for the stiffness of the shoulder, will be classified into three stages. There is a freezing, the frozen and the thawing. All these three stages which is implemented in the frozen shoulder patients, and this will go on the basis of the recovery and basis of the patient where they are affected with the diabetes and the patient who are affected with the heart problems are most common in the affected with the frozen shoulder. So these four conditions are the most important conditions in the shoulder injury syndromes, and they hold a separate base and the separate treatment plans. Even though we are having surgeries for the rotator cuff, even after surgery, physiotherapy management is most important in all these stages. As if we are studying the physiotherapy management here, we need to maintain a keen concentration on how to treat a surgery patient and how to treat a frozen shoulder patient and how to treat a dislocated shoulder patient is most important in our physiotherapy. Hope you are understood in this video. We'll meet on the next video with a new topic. Thank you.